Thank you. Okay, we're ready to go. So here is our weekly update. So I have the number of cases in Clay County. And so as you see, September 6th, that was 165. And now as of the 13th, we've jumped up to 291. It shouldn't be too much of a surprise as we look at Cass County, and they had jumped up previously ahead of us. They were at 518, and this week they're at 527, so the jump isn't as high, but they had certainly a large increase previous to this. Our active cases in Minnesota, 13,829. And then that was on September 3rd. Then the September 13th numbers, 14,693, so still an increase. Active cases in North Dakota, 2,714, and we're at 2,815. So we're seeing still some increases in those numbers. The next page gives the active cases by age. So you can see again, as we talked about, we're seeing the younger population. We're seeing some increases there that we had never seen previously. So the 5 to 9-year-olds at 29, 15 to 19-year-olds at 31, and the 20 to 24 is at 30. So we're seeing still some greater increases in those younger age groups, which we anticipated with this Delta variant. We're still seeing numbers at the 35 to 39 range as well, the 25. We're seeing less in the elderly that we had previously last year, which was really the highest numbers, but now we're seeing the younger age groups. And then the next page is the cases per week, so you can see again, we've got a little bit of a bump up at the end now in August and September. So we're not seeing a decline or not a leveling off yet in those cases. So the graph just shows from back in 2020 through August or September 5th of 2021. So you see the highest, again, as we know, the highest number of cases back in November, and now we're getting a little bit of an incline in this last month. And then I'll let Becky talk about hospitalizations.
Good morning, Becky.
So this graph again just depicts number of Clay County residents that are admitted to the hospital on a weekly basis. You can see we had a little bump up the week before last with nine of our residents having to be admitted to the hospital. Last week, so far, we've had 3 that have been admitted to the hospital, and again, there's always a lag in the data, so I would expect that number to go up a little bit as the data gets a chance to catch up. And then since August 1st, the average age of our cases here in Clay County that have required hospitalization has been 54, with a minimum age of 4 and a maximum age of 90. And we've had 5 admitted to the ICU since August 1st. And then this just depicts North Dakota hospitalization data. So again, this is not our local hospitals only. This is for the whole state of North Dakota. So you can see as of yesterday, there was currently 17 in the ICU for COVID. And then the ages are depicted on the right-hand side of the picture too. So we are seeing some pediatric hospitalizations due to COVID throughout the state. In comparison, these numbers are going up a little bit. So last week at this time, there was 11 in the ICU, and now that number has gone up to 17. And this picture is just showing, this is Sanford system as a whole, so across their 22 hospitals. This picture isn't meant to show, hospital capacity for our local healthcare systems, but it's just compiled data that Sanford has put together for all the COVID patients that they're seeing. And so you can see of the 26 COVID patients that are on ventilators, only one is vaccinated. So this picture really underscores the importance of vaccination. A year ago we would say your greatest risk factor for being hospitalized for COVID would be underlying health conditions, and this year the greatest risk factor is not being vaccinated.
Good morning.
Morning, Jamie.
The next slide is what we usually look at in terms of the vaccine that is being provided by Clay County Public Health. So looking at our total doses, 15,447. And this past week, we had just 47 doses administered. And just want to also point out the fact that, you know, we have the listing of all the available sites people can have vaccine on our website, as well as the Minnesota Department of Health site. And our pharmacies are all continuing to provide vaccine, as are our healthcare providers in our community. So the opportunities for vaccine are plenty. And for public health, each week we have our clinic at the Family Service Center in our office, and we are planning for a clinic this Wednesday from 1 to 4:30, and we're offering both Pfizer and Moderna vaccine. And we are also going back to the DGF school on Thursday to do some second doses, and we will be in both of those buildings, working with our 2 school nurses that are working in those buildings as well. And then Friday, we're going back to MSUM at the Comstock Union from 9 to 1 and providing both Pfizer and Moderna. So each week, what we do with the minimum that we do is the clinic and the Family Service Center, but we also reach out to the homeless shelters, we reach out to corrections, the juvenile detention center, and anyone who's told us they're still out there that's homeless and has not received a vaccine. So we go to those sites when there's a need. We also ask anyone who's struggling to get a second dose somewhere that they give us their name, and we will try to connect them, if not with our own clinic, then with one of our pharmacies or healthcare facilities. That's it.
Do you want to do the?
Sure. And then the next slide, the statewide data that we've been sharing each week, and we are making some progress this week. The number of people across the state that have had at least one dose is 71.3%. A month ago, we were at 68.9, so it's slow but sure. And then those that have completed the vaccine series this week at 67.3, and then a month ago we were at 64.6. But also the breakdown there by age group, I think it's nice to see that for those 12 to 15-year-olds, we are seeing 52% that have had at least one dose and a 45% that have had completed the series. And then a month ago, we were at 46% for those with one dose and 38% for completed series. And then the 16 to 17-year-olds, we are at 59% who've had one vaccine, 54%, and that have completed the series. So overall, we're kind of catching up with that 65-plus population that was our highest percentage, but we're making some slow progress across the state of Minnesota.
Okay.
And this is just our breakthrough cases. So this is updated weekly by the Minnesota Department of Health. And as you can see, that top number proportion has gone up a little bit from last week. So about 0.6% of fully vaccinated Minnesotans have wound up testing positive for COVID. The breakthrough hospitalizations are still low at 0.036%, and breakthrough deaths at 0.004%. So still very, very small proportions for hospitalizations and deaths. And then we just wanted to make sure that the public is aware that we have several testing options in our local community here. So the Vault testing site here in Moorhead is still open. Also, Minnesota residents have an option to order a at-home saliva test kit free of charge. The Fargo Community Test Site is another location. Both of our healthcare systems, Sanford and Essentia, offer testing, as well as Family Healthcare, and then Walgreens, the pharmacy here in Moorhead. All of the details of this are listed on our website with hours and locations for people to view.
Thank you. Yesterday, we met, our CARES 2 committee met, and we had some discussions about planning moving forward and some of our concerns regarding, or how we plan for the new executive order that's been issued but yet to be or no date has been set for it, but we need to plan for that. Obviously, there could end up being much more testing. We are one of those businesses or companies that would be required because we have over 100 employees, and our number is about 640 employees. And so we will need to follow those rules as they're put into place. So Steve, I guess I'm going to ask you, I want to try to keep us on time today. We got a really busy schedule, but if you can maybe just go over a little bit about what we talked about there and how we can start the process in terms of knowing who has the card and who doesn't, and that type of thing. Thank you.
Thank you, Mr. Chair. As you mentioned, right now, we don't necessarily know the specifics, the guidelines that is going to be set up by the federal OSHA department. But in Minnesota, we do know that we're one of 22 states that participate in a OSHA plan. And as part of that, we then are responsible to follow the federal OSHA guidelines and or develop our own within 30 days of implementation from the federal guidelines. As I mentioned, one of the things that, as Commissioner Campbell mentioned, one of the things yesterday we talked, one of the things that we do know is we know that a portion of the guidelines are going to be a requirement of who is vaccinated and who's not. That's going to be a requirement. And so later today, Human Resources is going to be sending out an email requesting that our employees provide us their vaccination status if they have a card that they would be able to forward that. We would be looking for our employees to forward that, bring that forward.
So I think that's just the update, and I think we want to assure our employees that goes into an HR confidential file, and it's just that at some point, we're going to need to be able to verify based on the new rules. So we want to get a start on that moving forward. And moving forward with those who aren't, and the requirement for weekly testing can become an expensive item, and so we need to be able to kind of have a number of how many of those are so we can prepare financially to handle that, so. All right, do you have anything else for us, Kathy, Jean, Becky?
No, I
Frank,
think that's it.
I attended or watched on Zoom a meeting on CHAC, and they indicated that our nursing homes, that the people in the nursing homes are vaccinated, but it's the workers that aren't vaccinated. You know, that's why, as far as our rates, they could be higher if the workers would be vaccinated that work there. But the people in the nursing home that are residents there are pretty well vaccinated, but it was an interesting fact that it's the workers that aren't vaccinated in those places, so.
That's correct.
I just thought it was an interesting fact that was brought up there.
Oh, that's very good, yeah.
Right, anything else for us? Thank you. We'll see
Thank
you
you.
next week.
Thank you.